This next patient is a diabetic patient who stepped on a nail about 4 to 5 days prior to this ER visit. There is the lesion right there in the ball of the foot where the nail went through the shoe and into her foot. She was put on antibiotics, given a tetanus shot, told about signs of infection, and sure enough, she developed them. Redness, swelling, soreness. You can see the whole foot is swollen and red. Even some early blister formation looks like at the base of digit number 2 and number 3. On clinical presentation, she had a low-grade temperature, she had tachycardia or elevated heart rate, and her lactic acid was elevated. That means that with the source of infection, she was truly septic. She was asked to stay in the hospital, but she refused. That's right. Being the holiday weekend, she had things to do and could not stay in the hospital that day. So we compromised. We gave her aggressive IV fluid hydration and a high dose of IV antibiotics, clindamycin. She was then instructed to return as soon as possible for admission and further treatment. The clip you're about to see next is the progression of the infection less than 24 hours after the original clip.
So this is the same patient we saw yesterday with the infected foot secondary to the nail going through the sandal or sneaker and tennis shoe. And of course she had an infection, she had sepsis criteria. We wanted to admit her, but she needed to go home. And that's all right. We gave her some IV antibiotics, some fluids. She promised to come back and she's here. So today you can see that the redness and the swelling is much worse. I told her we would start seeing some blisters, and sure enough, here they are. And now the redness goes up to the mid-tibia here. Her vital signs and blood work actually looks better than yesterday. But locally the infection is worse, like we talked about before. Compare those two legs. Look how much redder that is compared to that. The other concern is something you're going to end up needing is an MRI of that foot. Because if that needle went deep enough and got to the bone, then you could have bone infection, osteomyelitis, and that's really hard to get rid of. So the likelihood you'll end up with an IV, like a PICC line with antibiotics for like a month, is very possible. And of course, it's much harder to get rid of the infection. If they stop antibiotics too early, infection can come back. So that's why it's so important to get into the hospital and do this. Yeah. Thank you so much for letting us share this. Appreciate it.
Hi you guys, my name is Gabby and I'm here to do my testimonial on Thynergy. Thynergy has given me way more energy than I had in recent months. It's helped me lose about 20 pounds and I'm really happy with my current body and the form that I have. So please check the link below, recommends Thynergy, and I think it'll work for you.